So the first step is simply to observe what position is their arm the most comfortable in. And whatever configuration their brain is putting their arm in, that's where we're going to start. So again, you might notice that the arm or the elbow lies more towards the center body, more out towards the side, wherever it happens to be, that's where it is. We're going to support the brain in what it's already doing and then add in these tiny variations. So if this little one's arm and hand is the most comfortable in this position here, I'm actually going to use my hand like a soft, gentle sandwich, and I'm going to be the bread, the soft, gentle piece of bread that's kind of sandwiching her arm in between her own chest, her own body here, her ribs, and my soft, gentle, supportive hand. So I'm not adding too much force. It's more like a gentle hug that I'm doing to help support her arm in whatever position is the most comfortable. And I'm kind of over top of her forearm and her wrist, just like you were here if you followed along. And I highly recommend, even if you're a parent and you don't have spasticity in the arm or the hand, but your child does, I highly recommend you try those movements first on yourself so you can really feel the difference between the upper ribs moving and the bottom ribs moving, and how these gentle, respectful movements can create change in yourself and in your child. So wherever their arm happens to be, I'm going to gently sandwich it in between my gentle hand and her own body here herself. Now, I'm going to imagine that it's her right arm that has spasticity in it. So we're going to be turning to the right like this. Now, she's kind of snuggled in between me and my chest. So my hand is sandwiching her hand into herself, but my hand is also sandwiching her whole body, her back into my chest. And I'm going to use my body as a sandwich to help look and rotate a bit to the right and then coming back. And notice I'm not going as far as I possibly can. I'm keeping the movement very, very slow and very small. So her brain has the chance to experience it fully. If you go too fast, their brain can't keep up. So we're basically highlighting this tiny little movement of looking to the right and coming back while I'm sandwiching her wrist or her hand in the most comfortable position for her. So I'm going to go a little bit to the right and come back. And we're just going to do that a few times, nice and slow and gentle. And then I'm going to move my sandwich hand down to her elbow and support her elbow wherever her elbow is the most comfortable. So I'm gently hugging my hand into her elbow, into her ribs. And in this position here, we're just going to gently turn and look a little bit to the right and coming back. Turn a little bit to the right and coming back. And you can actually physically see the doll change how it moves as well. So you can see, the ribs on this side would be moving a little bit more backwards, whereas versus if my hand was on her wrist hand area here, sandwiching into her chest a little bit more of her chest starts to move. And so notice what's true for your child. So your child might be experiencing the same thing, or they might be experiencing something completely different. Again, it's these tiny little variations of quality movement that is filling in these missing gaps for their brain. So these little pieces are giving their brain a fuller picture of what's possible. Oh, you can move these ribs way down here with the arm. Oh, you can move the chest and the sternum, maybe the collarbone a little bit more. And if they're comfortable and they're engaged with you, you can start to add in even more variation. So maybe you can slide the hand a little bit down towards the belly button. Maybe this is a safe, comfortable, gentle movement for them. And it totally changes the relationship of how they move. Maybe you can slide it up towards their collarbone, maybe towards this collarbone, maybe more towards the left collarbone. And we're still just turning the one way to the right. And then maybe you can change where the elbow is just a little bit, making sure it's still comfortable for them. Their brain still feels safe. We're using these slow, gentle movements to access their brain and say, hey, this is a safe movement. Hey, this is a possibility for you that you can use.